the surgeries we're doing is like this. It's like you have a house, and the roof, the top of your house has a leak somewhere, and rain water is coming down into the house, and it's ruining the drywall, and you can see it. You can see water damage. The surgeries that I could do were like going into that house, tearing down that drywall, ripping out the moldy insulation, putting in brand new insulation, and rebuilding the wall. But not fixing the leak in the roof. That's what I was doing. And the way I realized that is that I could do a perfect surgery, and some people would get better. Some people would stay the same. Some people would get worse, even though I did the exact same perfect surgery. And some people would get better before I could operate on them.
Thanks for joining us once again. This is Greg, usually from Teslafaninsight, but today we're having a discussion of Dr. Guby and Doobie, his faithful or trusty dog. This is a veer from our usual Tesla coverage, but as most of you know, we usually spend about 25% of our show reviewing health tips shared by a number of different doctors that are sort of part of our medical consulting team, if you will. So over the past 3 years, I've interviewed approximately 200 doctors, and the idea was, based on specialty, to see if I could get one or two recommendations from them of things to consider for better health management. Now, I just want to point out that I'm sharing with you our top 10 list today because in a tangential way, most of our top 10 list is what's covered by Dr. Guby in his show, but our list is literally, 30 to 50 tips deep, and feel free to like and make a comment because we can make available the rest of the list to you. So please note, a number of our health tips recommended are down below. This is Greg for Teslafaninsight. If you enjoy this show, please take time to like and subscribe, and you'll notice that even though we cover automotive, the end of every show includes health tips along the lines of what will be covered today. So the first tip that I found interesting was the fact that of the 200 doctors surveyed, 70% of them were all doing some form of fasting. And when I asked them, well, what kind of fasting you do, their range was amazing. One example is there's an MD PhD at the NIH, and he talked about the fact that he has an eating regimen where he only drinks in the morning coffee or other juices, has a meal approximately 12 o'clock into the 2 o'clock range in that time frame, and then he'll head home and have dinner with his family, and that's sort of his regimen of eating every day. Now, I recommend that you consider this. There's a lot of ways you could do it. My favorite that I actually do, it was recommended by a pediatric anesthesiologist in Bethesda, Maryland, and he recommended that you eat on half of the day's calendar. So eat on 12 hours or during the 12-hour period, and don't eat in the other 12-hour period. I liked it because it wasn't too stressful on what I might already do, and I found it to be effective. So that's my recommendation, but there weren't any, everybody is doing the same thing. There's in general recommended fasting. Number 2 is a recommendation that came from a doctor named Dr. Dinesh. He's an MD PhD at the University of Michigan. He recommended, even though he's a gout doc, this is a 5-pound weight. He recommended putting on a 5-pound weight on your leg and lifting it in 25 times per leg every morning. The reason he recommended that is he pointed out that by strengthening the quad muscles, there'll be a less of a chance as you age that it'll strengthen the area around your knees, lowering the chance that you'll need to have knee surgery. So a good point, and I think you'll find it very useful. The third concept or third point that was made came from a doctor that I met who's a retired psychiatrist at Georgetown Hospital. What he shared was, he said, I want to encourage you to consider doing a 20-minute walk every morning. And I thought it was interesting. There's a lot of, endorphin production and other health benefits. And I found it interesting that his recommendation dovetailed with a Stanford doc I met who suggested every morning doing a 15-minute walk at least. The reason is that what he argued was that each day we consume food. By doing at least a 15-minute walk every day, you actually end up consuming most of the calories that you will eat for the day. And so therefore, if you exercise, if you're doing a 3-hour or regimen of exercise for the day, for the week, for example, those extra workouts, in essence, will cut into your fat stores. So it's a nice combination of process, if you will. The next recommendation that was presented to me that's sort of on our top 10 list related to a doc that we met from the University of Louisville, who's a cancer doc. What he said to me was, we have a problem in the country now, which is that people are working harder, they're coming home, eating late, and then jumping in bed. The problem that creates is that ideally you wait 4 hours from when you've eaten to when you go to bed to allow the stomach acids to digest the food you've eaten. If you choose to simply jump in bed quickly, you run into the problem of acid reflux, but basically the acid in your stomach will roll into your upper respiratory area on a regular basis, and that's when you have to come see me as an internal doc because of the impact those acids have had. So he pointed out that minimum 2 hours, but ideally 4 hours before you go to bed, don't eat anything. The next recommendation that I got that is sort of a regular relates to weights. I ran into a doc that said to me, you realize that if you get 1 or 2 weightlifting sessions in a week, you will outlive everybody you know. So I was like, whoa. I was an athlete and have had the experience of lifting heavy or lifting a decent amount. So I was impressed by the recommendation and I wanted to share it with you. The next thing I wanted to review is sort of discussions, interviews with kidney doctors. And there are 2 of them that I sort of surveyed process-wise, both of them in Bethesda, Maryland area. One is from Rockville, but in one case there was a recommendation that you eat no more than once a week fried foods. What he pointed out is what people don't realize is that our bodies are multiple thousands of years old. And anytime you start eating substances that are inconsistent with what we've sort of grown and built on over time, your body gets confused as to what it is you're putting in it. And instead of properly digesting that, it will actually store those substances next to your largest internal organs, hence some of the fat that you could pick up from the fried foods. The second recommendation, sort of this is a double shot that came in from another kidney doc, was that he pointed out that there's a need to try and avoid meat 3 days a week. And I was like, wow, well, the kidneys deal with meat fine on a regular basis. Why should I be concerned about meat every day, if you will? And he pointed out that unlike your heart, which may get stronger with exercise, etc., the kidney just gets tired, and then you need a new one. And so one of the ways to address this tired kidney, if you will, is to cut your consumption to 3 less days a week, allowing the kidney to rest, because then it has a chance to somewhat rejuvenate itself. But more importantly, you're not overworking it. The next recommendation that I directly and indirectly got from Dr. Guby is that when I was in college, I actually was what's called a sleep researcher. So I worked at the Stanford Sleep Clinic. You've heard the term REM, or rapid eye movement. So Dr. William Dement came up with that, and he ran our lab at Stanford. So the recommendation that I give to all my viewers relative to sleep, along the lines of Dr. Guby's arguments, is to make a point of taking a 2-week period where you go to bed and wake up at the same time every day. The reason for this is there's a concept called a circadian rhythm. So your body operates on a 24-hour time clock, and if you give it a regular rhythm of sleep and rest, you actually end up a lot healthier in the process. So what'll happen is that you'll start to notice that there'll be, times of day where you get tired, you want to eat, you want to study, whatever it is. After I learned this, one of the PhDs that was in that lab also pointed out to me, if you can make a point of modifying your work schedule towards when your body likes to sleep and wake, you'll be a lot happier in the work you choose as well. You notice Dr. Guby pointed out that there's a lot of emergency calls that tend to affect his ability to get and maintain a good sleep schedule. So the question is, can you establish a circadian rhythm and maintain that? You notice when you go on flights and you're switching time zones, you end up a lot more tired. And again, please try to maintain the same sleep and wake schedule on weekends as you do during the week, because the goal is to get your body into a rhythm that allows you to manage better your health based on having that consistency that's going on. The next thing that comes up is there's a well-regarded Stanford doc who is now retired, but we had a class with him at the medical school as part of an alumni event, and he had recommended omega-3 fatty acids along with 30 minutes of walking daily. Slim to no side effects, all benefits, one that you may want to consider. The next recommendation that was presented to us is, I ran into a researcher from the NIH, and one of the things he looks at is Alzheimer's and other diseases in that realm. So what he recommended was that learning how to play an instrument, going dancing once a month, maybe twice a month. There are certain activities that move your brain in a different direction. And so if you can introduce things that have your brain processing going in different directions than you normally do, that actually can be very beneficial in terms of the impact that might have on your the functioning of your brain. So, the issue that comes up now is that we have other specialists that have made recommendations that I could present and keep going, but I wanted to kind of introduce this top 10 list because as Dr. Doobie or Guby pointed out, there's a lot of little things that one can do to enhance your health, all of which can add up to better life outcomes. Based on having spoken with a number of docs I just described, we now have some ideas that might enhance your ability to stay healthy and be healthier. So this is the end of our list today relative to health tips that harmonize with Dr. Gooby's recommendations. What I'm going to do in terms of relaxation that he recommended is also include some video at the end of sort of ocean sounds that allow you to actually spend time and enjoy with your eyes closed or open, sort of ocean sounds that we have that I think will help in terms of the relaxation component of what he discussed. I believe that we have a great relationship with water, and you heard the water behind in his show. I'm definitely putting a water effect beneath, which is the sound of the water that you see on the screen for the B-roll. Thanks for joining us. And I close with a Rumi poem. Cease looking for flowers. There blooms a garden in your own home. While you go seeking trinkets, the treasure house is within. Thanks for joining us. This is Greg for Teslafaninsight. Just au revoir, le hitro hodai fezdrazi ni hama, konbanwa, namaste, salam, and arrivederci. And in Jamaica, we say enough respect, walk good man. Thanks for joining us. Have a great day, and bye for now.